One of the biggest myths about scoliosis is that it doesn't continue to progress once someone's done growing in adulthood. Now, one study actually followed adolescents that had scoliosis over a 40-year time frame, and they found that 68% of the adolescents that had scoliosis, their curves continued to progress or get more severe or worsen when they were done growing. Hi, I'm Dr. Chris Skubels, leading authority in the non-surgical treatment of scoliosis. And in this video, you're going to learn exactly why and how scoliosis continues to progress in adults. What's interesting is most people think about scoliosis as an adolescent problem or a problem that only happens in children. But only about 3% of adolescents get diagnosed with scoliosis. But once we hit 40 years old, it's about 9% of the population. At 60 years old, it's about 38% of the population. And between 70 and 90 years old, it's about 50 to 68% of the population. So scoliosis is a much bigger problem. It's much more prevalent in adults than it is in adolescents. Now, when we look at adults with scoliosis, we have two primary types of scoliosis. One, we had people that had scoliosis when they were a child or an adolescent, and they still have scoliosis as an adult, but many times that scoliosis tends to progress and get more severe, meaning it turns into a degenerative scoliosis as an adult. And then we also have people that develop a new scoliosis called a degenerative de novo scoliosis in adulthood. And that typically develops in women around the onset of menopause, typically around 50 years old, and a little bit later in men. So the scoliosis that develops when someone is growing is actually caused by a genetic factor where the bones actually grow deformed or misshaped. The spine is actually growing deformed. But as curves progress in adulthood, it's a degenerative problem. What's also interesting, when we look at teenagers, curves in the thoracic spine tend to be more aggressive and tend to progress at a faster rate compared to curves in the lumbar or thoracolumbar spine. But the opposite is true once we look at adults. And that's because in adults, we are in a war with gravity. And as gravity pushes down, it's the curves in the lumbar or the thoracolumbar spine that tends to be more aggressive or progress at a faster rate. The reason for that is in adulthood, the ribcage tends to stabilize the curve to some degree. Now, Chopin and al. Actually did a research paper where they looked at different rate of curve progressions, both in adolescent scoliosis curves that continue to progress in adulthood and adult degenerative de novo curves or new scoliosis that develops in adulthood. And what they found is when someone has a balanced double curve in the spine, those tend to be the most stable and typically they progress at the slowest rate. So in people that have a balanced double curve, the curve in the thoracic spine tends to progress at about 0.8 degrees per year and the curve in the lumbar spine tends to progress at about 0.9 degrees per year. So those large double curves tend to progress at just under 1 degree per year. The thoracolumbar curves in this area tend to progress about 1.4 degrees per year, and the curves in the lumbar spine tend to progress at 1.8 degrees per year. So we know that curves that people have when they're younger frequently do progress in adulthood, but we also know based on the type of curve and the location of the curve, that gives us the prediction of how fast or how rapidly that curve will progress. Now, when we think about the adults that have a degenerative curve that developed as an adult, those are the most aggressive. And those actually tend to progress at about 3 degrees worse per year. So what actually drives or causes degeneration in adulthood? Well, first let's take the example where you have someone that had a curve when they were younger. And so they still have that curve as an adult, but they have this asymmetry. Now, gravity is pushing down. And when you have that asymmetry, that asymmetrical alignment, that causes asymmetrical forces or pressures on the spine and the disc. And that asymmetrical pressure causes asymmetrical degeneration. In fact, on the inside of the curve, the disc starts to break down and decay and becomes wedged. And the joints on the inside, specifically the facet joints, they start to break down and decay. Now, as those joints and the disc break down and decay, you get more asymmetrical misalignment, you get a bigger asymmetrical deformity, and that causes more asymmetrical pressure. And hence, that causes more asymmetrical degeneration. So that process just goes round and round. Now, when we look at adults that did not have scoliosis when they were younger, but they develop in adulthood, the pattern is similar. But typically what happens is you start to get asymmetrical degeneration first. That's going to be some wedging in the disc, and you're going to get some degeneration in the facet joints. That's going to cause an asymmetrical deformity, meaning that curve is going to start. And as that curve starts and gravity pushes down, that causes more asymmetrical pressure on those discs and joints, which causes more asymmetrical degeneration, which causes more asymmetrical deformity, and the curve gets bigger and the process just continues and starts to snowball faster and faster over time. Now, there are some specific things that cause the joints to break down, decay faster, specifically in women. Women tend to have a higher prevalence of scoliosis, and their curves tend to progress earlier and faster, specifically with the onset of menopause. Now, with the onset of menopause, we tend to get bone thinning or weakening with osteopenia or osteoporosis. Now, as the bone weakens and gravity pushes down, those bones tend to break down, decay faster. Also, with menopause, we get a change in hormones, and with change in estrogen levels, that directly impacts collagen absorption. And collagen is the protein that actually makes up the connective tissue that holds the spine together. So we start to get some loss in overall spinal integrity. Another thing that can accelerate degenerative curve progression is muscle atrophy, specifically the multifidus muscles. When we look at degenerative scoliosis, in mild or moderate curves, we tend to find muscle atrophy in the deep stabilizing muscles on the inside of the spine. But when we look at severe degenerative cases, we tend to find muscle atrophy in the deep stabilizers on both the inside and the outside. So whether that atrophy is the contributing factor, or it's an association, meaning we just find it with it, or it's what actually causes it, we don't 100% know, but we know it's likely a contributing factor. In fact, once we hit the age of 60, we rapidly start to lose muscle mass and strength. We lose about 3% of muscle strength and about 5% of muscle mass every single year after the age 50. And once we hit 70, we tend to see a very rapid decline in muscle strength and endurance. People get very frail, where they're physically not able to hold themselves up, which we know absolutely contributes to the acceleration of degenerative scoliosis. Now, there are several predictors that actually tell us the likelihood of curve progression. One of those is the size of the curve. Once curves get beyond 30 degrees, they have an increased likelihood of continuing to progress in adulthood without treatment. Once they're over 50 degrees, it's pretty much a scientific consensus that they will absolutely continue to progress without some kind of intervention or treatment. Another thing that impacts or is a predictor of curve progression is when someone has global misalignments, meaning from the front, when the body is shifted over to the side. We call that a coronal imbalance, especially over 4 centimeters. That's a high predictor of both pain and curve progression. Similarly, when we look at the body from the side, when someone starts to shift or lean forward, we call that sagittal balance. When they get an anterior sagittal balance of more than 4 centimeters, that's a high predictor of both pain, but also curve progression. Another predictor of curve progression is a loss of the normal lumbar curve. In fact, this may be something that actually drives or initiates the scoliosis that develops in adulthood. You see, normally from the front, your spine should be straight, but from the side, you should have a nice curve in your lumbar spine, your mid-spine, and your neck. And when you lose those normal curves in your lumbar spine, the spine becomes less stable. Now, there are some theories that that is the thing that initiates the scoliosis developing in adulthood, is that loss of lumbar curve and the instability of the overall spine, leading to the spine to start to twist and rotate. Another predictor of curve progression in adulthood, when the L5 lumbar vertebrae, or the lowest lumbar vertebrae, has what's called a high sitting intercrescent line. Normally, that L5 vertebrae sits very low in the pelvis, and these pelvic hips are above that vertebrae, and that makes the spine more stable. We call that a spine that sits low or normal in the pelvis. If the top of that L5 vertebrae is above the iliac crest, it sits higher in the pelvis, and it makes it more unstable, which is a risk factor for curve progression. A way to think about this, if you have someone that's very short and wide and stout, they're going to be more stable. They're going to be harder to push around. If you have someone that's very long and lean, they're going to be more unstable. They're going to be easier to push around. So where that L5 sits in the pelvis is a predictor of stability and curve progression. Another thing, and some people think the biggest predictor, is when we have a lateral listhesis of a vertebrae of greater than 6 millimeters. So normally the vertebrae stack right on top of each other. But what can happen with the loss of structural integrity, the vertebrae can start to slip or translate off. That's called a lateral listhesis. That tells us the ligaments are no longer able to hold the spine in alignment, and the spine has become unstable. Now, when there's a slippage of more than 6 millimeters, it's a high predictor of severe instability and a high risk of continued or progressive degenerative scoliosis. Another predictor is the amount of rotation in the spine at the apex. When you have scoliosis, the spine is twisting and rotating, and the more severe the rotation in comparison to the size of the curve, the more likely that curve is to progress. Another predictor is when we have a high oblique angle of the L3 and L4 lumbar vertebrae, meaning when you look at the L3 and L4 lumbar vertebrae, if they are very tilted in comparison to a horizontal line, they're more likely to progress, but they're also more likely to cause pain. And the last one I want to talk about is when you have a sacral obliquity. Obliquity means an unlevel or unparalleled surface. The sacrum is the bone the spine sits on. And when the surface the spine sits on is unlevel, that can drive or cause the scoliosis to progress at a more rapid rate. This could be because someone has a short leg on one side, causing the whole pelvis to tilt on that side, or sometimes that sacral bone grows deformed on its own. So you need that surface to be level. So if the sacrum is not level and you have a sacral obliquity and your spine is sitting on an unlevel surface, that tends to drive the progression of scoliosis. So to summarize what we talked about, we know that curves absolutely tend to progress in adulthood. Whether it was a curve someone had when they were younger and they still have it as adult, or it's a new curve that develops in adulthood. We know not all curves degenerate at the same rate. The curves in the lumbar spine tend to progress at a faster rate compared to the curves in the thoracic spine when we look at adults. Also, when someone has two big curves or a double major curve, they tend to be more stable and they progress at a lower rate. Also, there are many risk factors or predictors of the likelihood of a curve progressing. Now, if you're watching this and you have scoliosis as an adult, one thing you definitely want to do is click on that link below and download our free ebook called Scoliosis Has No Age Limit. The other thing, if you have a degenerative scoliosis and you're not sure what to do, I'm going to encourage you to request a free discovery call. This is going to give me a chance to talk to you one-on-one about your scoliosis. Now, when you do that, we encourage you to send your x-rays to us in advance so I can review those. And on that call, I can tell you how severe your curve is. And then based on many of these risk factors we were talking about, I can also tell you the likelihood of your curve progressing without any proper treatments. And then I can also let you know what are some of the treatments you may be a candidate for, especially if you're looking to avoid a more invasive procedure like spinal surgery. But now that you know more about scoliosis and degenerative scoliosis in adults, to learn more about the most effective treatment for the scoliosis, click on our next video and I'll see you there.